This is me. Okay. Mrs. Carter, a teacher riding the MBTA through Massachusetts, saw a poster that said, "Quitting smoking was hard. Screening for lung cancer is easy." This made her pause. She'd quit smoking, and this seemed like the next right step. At the clinic, a CT scan found something suspicious. A biopsy said no cancer. She was safe. But here's the truth. For people like Mrs. Carter who used to smoke, some of their lung cells are like ticking time bombs. They're not cancer yet, but they run the risk of turning into something dangerous. Mrs. Carter's doctors didn't monitor her, assuming she was fine until next year's screening. When she returned for her annual checkup, her relief turned to shock. Cancer had developed, now harder to treat. Lung cancer leading to about 125,000 deaths every year. Here's the reality. If we catch it early, 64 out of 100 survive. If we catch it late, only 9. But most people, about 3 out of 4, are caught too late. This is where my work begins. As a PhD student, I'm building tools to catch these risky lung cells early and to protect communities as a trusty sidekick. AI doesn't crack health mysteries alone. Rather, it's a tool that helps physicians to find the right clues. Hop on board to see how I am assisting medical experts in spotting lung cancer risks faster and how you, like me, can chase big ideas to shape healthcare right here in your community. Let's dive into my research that helped people like Ms. Carter by spotting lung cancer early, even when the clues are scarce. Imagine a detective solving a mystery with 2 evidence bags. One has a detailed lung cell map, like a zoom-in city, and the other has the cell's secret playbook showing which genes are the troublemakers. Our AI tools are helping the detective with brilliant at blending these clues, cells, images, and genes to tell whether the cells are risky or not. Better yet, they rank the danger, like sorting cases into low, medium, and high risk, so doctors know who needs help first. Here's the real magic. It works even when some clues are missing. In places like local hospitals, patients might skip some tests because of tight schedules, limited equipment, or high costs. No problem, our AI adapts like working with half a puzzle. We break the map into pieces, connect them like a web, and pick the loudest gene signals using algorithms that crunch patterns and link connections. And then our AI scans whatever's available, images, genes, or both, and rank the risk in seconds. The flexibility in prioritization can help local hospitals move faster and save more lives even when the resources are tight. While the AI tools are advancing lung cancer research, they're also unlocking new possibilities in brain diseases like Alzheimer's. It impacts so many grandparents and remains a tough mystery for scientists. We studied close-up pictures of brain tissue, remaking part of our brain. Unlike lung screening, we look at these pictures after someone has passed to help researchers better understand what causes Alzheimer's. So much is unknown. What sparks memory loss? And why do some people stay fine despite brain changes? Right now, treatment can only help with symptoms. No cure exists. To solve this mystery, our AI tool works like a collaborative duo. One is like a speedy writer turns data tables into clear summaries, such as this region has tiny bleeds and damage. And the other, like a clever student, take the summaries, pair them with brain images, and learn how to spot issues like bleeds, and create new summaries when new images come in. They speed up research and help scientists analyze thousands of samples within seconds to uncover new disease patterns. By paving the way for future treatments, they are setting the foundation for clinics to offer more effective care and showing how Clue blending AI can assist brain questions just like us. All this work means so much to me because they're tied to my own unexpected journey into science. First, in business school, 4 in undergrad, 2 for a master's, and 2 starting a PhD in it, chasing deals, not degrees. I never imagined I would end up here until the pandemic hit. Watching healthcare workers overwhelmed and patients like Ms. Carter's dog struck me so hard. That's why I switched from a PhD in business to the one in computing and data sciences, my current program, and determined to use my math and coding skills to help save lives like hers. It was a bold move. My first project that aims to blend medical images for cancer detection was a total flop. They couldn't beat any standard methods. That setback taught me just how fascinating and how complicated biological data can be. And more importantly, that behind every single data point is a real person. Honoring their struggles became the reason I built the tools I shared today, and with support from my fantastic mentors who always remind us our mission is to create methods to fit the science, not to make science fit the methods. My journey goes to show it's okay to change plans, and it's okay to stumble as you find your way. Science isn't about nailing it at the first try. It's about asking questions, making mistakes, and keeping going. Every failed model unlocks new secrets, showing curiosity, not perfection, sparks innovation. This journey reshaped my understanding of research, not just at work living in labs or papers, but as something meant to serve real people in real communities. That brings up a question that I keep coming back to. How can these AI tools look like in practice, in places that matter most? Picture hospitals nearby, like UM Wellesley or Beth Israel, where doctors are racing against the packed schedules. Our AI can be a trusty sidekick, pathing through the images or other data and catch patterns, such as risky lung spots or brain changes that can possibly slip by. For a family doctor, they can help flag the risks earlier, speeding up specialist referral so patients get the answer sooner. Imagine a local community using an AI-powered app to remind people like Mrs. Carter of getting lung screenings, or to teach students about brain health. It can even inspire startups to build new tools that deliver care easier and fairer from large hospitals to small clinics. Now, picture yourself making a difference right here in your community. How can you get started? You're at the perfect time to jump into health and AI, and you don't have to be a pro to start. Join a coding club at school to make an app that tracks health data. Take a bio class and explore cells that can teach and guide AI. If you love art or writing, then design posters or stories to explain lung cancer screenings to others, just like the one Mrs. Carter saw on the MBTA. Start small. Chat with your family about getting screened, especially if they smoke. It's a simple step that can save lives. Visit a local library to read about AI, or to ask a teacher about health tech projects. Every single choice you make can shape a future where you're helping doctors spot cancer risks or researchers fight against Alzheimer's. Your curiosity, your ideas can shape healthcare right here in the local community and even beyond. All these things connect to a larger idea, weaving technology into the fabric of our life, our scene today. To me, technology isn't separate from life. It's how we make sense of its toughest challenges. Clue Blending AI is part of that fabric, combining what cells reveal, what doctors see, and what patients need. It's not just about smarter tools, it's about creating clarity. So patients hear, we find something, we know what's going on, and this is the next step, not just we found something. If you're in high school, joining a mission to tackle health challenges may sound huge, but you don't need to know everything now. I don't know how to read tissue images when I started. I learned by diving into bio papers, tweaking code, and pushing through failed models. Whether you're into coding, biology, design, or storytelling, you belong in this mission. Healthcare needs people who think differently, ask bold questions, and design tools that empower doctors, not replace them. That MBTA poster is still a favorite, but I'll add another. Running AI is easy. Saving lives is hard. Your ideas, your spark, can create a future where healthcare saves more lives and communities like ours are stronger. That is the heart of progress. Thank you.